the challenge with being up a little higher is then sometimes you end up pushing the device away from you. So as the chair is positioned on the keeper, that helps stabilize, if you will. So at some level, you probably want the crank to be at or below the level of the chair, such that when you're pushing, you have a downward vector keeping the device connected to the ground.
We now have a wider keeper, which allows you to put your chair on the keeper,
Yes.
and keeping it stable from moving away. But let's talk about proper setup in this way with my chair positioning, my foot positioning, and just getting started.
Yeah. So I like the increase in the width of the device as well as the width of the keeper, because if you can truly stabilize it with the keeper and the chair on top of the keeper, then you have greater potential to put a little more load into the system. Now, in the upper extremity, we wanted less load. In the lower extremity, we'll probably want a little more resistance. So that's important in order for us to stabilize the device. So all of these new design features are really quite nice. With regards to proper distance and proper positioning of the torso and everything with regards to the bike, you will want to sit a little farther forward in the chair such that when the leg extends, it doesn't hit into the front edge of the chair. And so that will sometimes require pillow support behind you in the chair, or you can assume a reclined position, either way. And again, pillow support can sometimes be nice in a way of maintaining that position for a prolonged period of time. The other thing is trying to figure out how far away you should be. We've talked previously about putting the heel on the pedal, and the leg should almost be fully extended at that at this position where the crank is the farthest away from the hip, or at the most extended, such that when you bring the ball of your foot just forward of the pedal spindle, we'll have a little bit of knee bend, and that's about the right position. Now, you can be a little bit closer than that if you want to, but the problem is if you get too close, then it'll not be great for the hip or the knee.
With this position, one thing that I like to do is sometimes take a resistance band and or weights, hand weights, and do some upper body while we're doing it.
Yeah.
But also just sitting up and reaching forward.
Yeah,
which really engages.
That's a nice low ab type exercise. The thing that makes it difficult is as the torso comes up, we come up into that what's called closed pack position of the hip, or approximate that closed pack position of the hip, such that if a person has poor hip mobility, that's really a challenge. And no, it's not, and it really makes it impossible for people. Or if people have a little more of a belly, it's really very difficult for that person, just because you have that space or that we'll say soft tissue that's blocking you from getting up into that position. So we'll see our lean people, so that the reclined position for a deconditioned person is the best position to start out with. But if a person has good hip mobility and lean body mass, then they can try the sit-up exercise to do that, and that's really quite a challenge.